Hello, everybody, and welcome back to another ARP Neuro Q&A show. My name is Jake. I'm the ARP Neuro Trainer, and with me, as always, is the infamous Matt Dell. Matt, it's good to see you once again. How you doing over there in Chicago?
Doing fantastic in one of our doctor's offices. So all these books behind me, I've never read them, so they're obviously Dr. Brian's. So glad to be on today.
They look good, actually, in the background.
I know. I like your background a little bit better, and we're going to introduce our new participant. Go ahead and tell everybody a little bit about our new participant on our Q&As.
Yeah, we do have a new addition here. His name is Stretch Armstrong, and that was named by one of our doctors, Dr. Sam. We love it, and so he'll be joining in on answering questions and kind of getting better idea of where pad placements. We thought it would be a lot easier. So that was Matt Dell's idea. So it was a lot of money. So if we get in trouble, we can blame Matt for that.
I love it. No, it's going to be great to be able to show anybody that's participating, pad placement and muscles. And, I'm excited that we've got Stretch Armstrong. I love it.
100%. He's going to be fun. You want to kick it off, Matt, and then we'll kind of run through this?
I'm going to just give everybody a brief overview of ARP Neuro. You can go to the next slide just to kind of educate everybody a little bit about the technology. The technology's been around for about 20 years. It was the manufacturer spent a lot of time working with professional athletes, huge recovery, 60 to 80% faster recovery for, from traditional chiropractor or physical therapy, and huge success rate.
Yeah, 100%. In fact, as far as the success rate, as you can see here, the recovery time is a lot quicker. Oftentimes when you're looking at recovery time, that could be one of the downfalls if you're in a sport or if you're trying to go back to work. It's usually recovery time that gives you a hard time. And that's where our technology kind of separates itself.
I love it. Yeah, as a matter of fact, most of the professional athletes, sporting teams, they have all been taking advantage of this technology for many years to try to get their athletes, which everybody's paying to watch and see and perform, back in the field. On our website, we've got just a sampling of some of those athletes. If you have not checked that out, I'd suggest it, and you can kind of take a look at all the different sporting teams and some of the great videos and testimonials of the technology.
When are we going to get pickleball on there? I think we have some pro pickleball players.
I think it's happening. It's taken over the world. I mean, I can barely walk from a 1.5 hour pickle match last night, so I get it. My personal story, this is my son. He was a senior in high school, broke his tibia and fibula. Did I say that right, Jake?
You did, yes.
Okay. I struggle with those big words, but he broke it, and unfortunately had to put a rod between his knee and his ankle. And it was about the 4th game of the season, and it was suggested to go do ARP treatment. And I was told that after 20 treatments, he would be able to play basketball. And I was a little skeptical, but I said, let's do it. Did 3 sessions a week, and sure enough, that's him playing the last 5 games of his basketball season, including the playoffs his senior year. Blown away by the technology, and I think, Jake, love to hear your take on how and why that worked.
Yeah, absolutely. So, and we see this case a lot, certainly on fractures and just like pre and post surgery, we've had a lot of success, but he's getting blood flow in the area. So like right after surgery, you have that running. So it generates a lot faster recovery time. At the same time, you're not developing that muscle atrophy that you would normally get, because with our technology, you can start to contract a muscle before you even put any pressure on it. So it saves on the joints, but the muscles start to work, before you're even actually getting into those movements. So it does cut your recovery time in half for the most part.
Awesome. Yeah, as a matter of fact, Logan University had a team, full due diligence on diving into the technology, and they now have opened up a clinic to treat 100% with the ARP Neuro technology. They've made it part of their curriculum, and they're going to now soon to have about 400 doctors coming out annually utilizing the technology in their practice. Just to give those that do not know, we've got really 2 products that we use. The RX100, which is you need to be a licensed physician. We have on our website an opportunity for you to go and find a clinic in your area. as well as the PRS, which is the over-the-counter. We're going to spend a lot of time today talking about the RX100. We've got multiple clinics that are on for this particular Q&A training session. So, but really the only difference is the RX contracts at about 500 contractions per second, and the PRS is at 245 contractions per second.
Excellent. And we'll go into more detail on that when I go into FAI stuff. And I'll kind of run through this one, if you don't mind, really quickly, Matt.
Sure.
Just kind of, some of the things that it has the ability to do. The picture here is with our PRS, but whatever the PRS can do, the RX can do tenfold, basically. Alleviates pain, certainly prevents injury, but helps with muscle atrophy. We kind of talked about that. It does a great job in increasing range of motion. The reason for that is because of the direct current wave. You have that ability to run muscle contractions, but at the same time, you're doing a movement. So one of the few electrical devices that you have that ability to do, because it works harmonious with your brain. At the same time, it's that ability to actually get that hypertrophy and build muscle like you would in the gym. The beauty of that, though, is that you're keeping pressure off your joints. So that's kind of a brush stroke of it. We'll go into more detail as we often do.
Yeah, I think this next slide, a lot of people ask, when they first discover this technology, Jake, it's, well, is it like a TENS unit? It feels, I've heard of a TENS unit, but how does this compare? So I'd love to get your take on that so that the people that are on can understand a little bit of the comparisons.
Yeah, 100%. That is one of the most common things we're told, is that it's similar to a TENS unit. Really, other than the fact that it does have electrical current in it, that's really where it separates itself. Again, you're going to see a lot of these things that are over the counter that you find on Amazon, or that you can even go to Walgreens and purchase for a couple $100. These are on alternating current. So it's only going to be, for the most part, surface level. Ours is on direct current. So you're getting cellular level contractions, which helps, again, break down and build in hypertrophy. Another thing to keep in mind is that on a TENS unit, that's physiological. With us, it's neurological. So you do have the ability to retrain those muscles.
Awesome. Thanks.
And, this is, we go through a lot of these. One of the things that's not actually on this list as far as common conditions, because it's such a difficult one, is FAI, and I'm going to talk about that. But as you can see here, there's a lot of other things. The protocol that I'm going to be discussing, it will target some of these lower body things, bursitis being one of them. So we'll kind of talk about that as we go into it. Matt, you have anything to add on this?
Yeah, I think that what's important to add is, like, as anybody has any issues or questions on any of these conditions, we're really trying to build up our online library on our website to really kind of address specifically how our technology, treats each condition, what the protocols are, whether it's with the RX inside a clinical environment or utilizing the PRS. So we're going to continue, to add to our library. And if you've got any questions as we go through this presentation, please use the chat feature. We'd love to hear the questions. It'll help guide our special guests that we're going to be bringing on shortly.
100%. All right. So before we begin with that, I want to jump over to this really quickly. So one of the things I want to say, I know there's a lot of doctors that are watching this. There's doctors that have this technology. Some of you are considering getting it. This particular protocol, when I get into it, is one of your very own. It came from a doctor that has used our technology, and I'll kind of get into that. But, people who have been experiencing FAI, there's kind of three types that just want to sort of give a brushstroke over. They're the pincer. As you can see here, it's oftentimes when there's an extra bone and it keeps that ball and socket from actually moving. You go into the cam, and as you can see here, the femoral head is not round. So now, because of that inflammation, it has a hard time, again, moving freely into that joint. And of course, in a very extreme case, if someone's unfortunate enough to have the combined portion, it is both the pincer and the cam. So now you don't have the ball, but you also have that extra bone that kind of goes over it and keeps the ball and socket from actually moving, decreasing your range of motion, but also kind of leaves a burning sensation that oftentimes people will experience with FAI. Here's a healthy hip.
Jake, can I ask a question on that?
Yeah,
can you go back just one?
Sure.
Out of curiosity, how does a patient know that? I mean, is it through an MRI, or how would they know, typically what condition they're in?
Yeah, that's a perfect question because to be honest, I don't even know if I do have FAI. Mine was done through, it was done through an X-ray. The doctor assumed that's what it was based on what they saw with the bones. I think sometimes that's kind of the go-to, especially if it's an athlete or they go through a repetitive motion. It's very common to develop FAI. I probably got it through running. I don't know per se if that's exactly what it is for me, but that's pretty common for a lot of people. And that's one of the reasons, unfortunately, is that sometimes it's just an educated guess. The doctors will go through a surgery and it doesn't completely work.
Okay.
So I kind of want to go into that. But it's a great question, though.
Okay.
So common treatments, you kind of getting into that are, activity changes. One of the things that kind of annoyed me when I was told I did have this was the doctor was like, you're just going to have to give up the physical activity. And anybody who knows me, I know I like to kayak. I like to snorkel. I like to be in the water. I like to work out. I like to run. This is not an option for me. I'm not the guy that's going to kind of take it easy and sit on a golf cart and not walk around and actually be active. So that didn't work. The other option was using some sort of anti-inflammatory medication. I did try that personally, never worked. And then, of course, there's physical therapy. There are certainly a lot of benefits to physical therapy, and it works really well in conjunction with doing any type of movement when we kind of combine it with our technology. And we will talk about that. Before I do, one last thing is, the final, that sort of final stretch after you exhaust everything else. Most times, an ortho is going to recommend surgery. Sometimes it works great. Other times, kind of like what you said, Matt, they take a guess, they shave down the bone and hopes that the joint is going to start to move freely. Unfortunately, if your muscles aren't firing properly, that's going to go back to the way it was, or perhaps even worse. It's one of the downfalls of actually having surgery if you don't really need it. And I think in my case, that was certainly it. So I want to go into this. So when I mentioned, and this is the beauty of the doctors being a part of this platform, you get involved in this technology, you come up with your own protocols. So I am borrowing a protocol from one of your very own. They're in Maximum Health Physical Therapy over in New Jersey. It's Jeff and Jen. Jen particularly kind of developed this. And I'm going to go over 3 steps and then, we'll kind of move on. But this is what I've been doing over the course of the last couple of weeks. And essentially the first portion is a 10-minute setting on normal polarity. So again, those of you who know that technology, that normal goes from the black to the red. And as you can see here on the bottom of the feet, I have the black pads, not the red. So those of you who know the technology, oftentimes, especially with the concussion, will have the black pad on the back of the neck. But in this case, it's the red. So we're running the red down to the black, and then of course the other black pad is just going to be anchored on the plastic backing, and it's going to be pushed aside. Now, one of the unique things about this first 10 minutes is we're running on 40 pulses per second. It has a tendency to pull out certain ailments or dormant areas. Believe it or not, everybody's reaction is different. So this is kind of a unique way of almost diagnosing issues. I know I have a certain breakdown point when we turn up the output power on this particular setting, but essentially 10 minutes, and then we move on to that next step. And as you can see here, it's another 10 minutes. Now, this step is considered that traditional movement therapy. Now, as you can see with the pad placements, I've moved the black from the bottom of the feet. Now we move it up just below the gastroc and where the Achilles tendon meet. And we kind of place it there on a horizontal placement. And if you can see that there with the red pad, I have that on the oblique going horizontally. Now, one of the things I want to mention, if you can see this green with the individual that has all 4 pads, these are crossed. So we're not doing a bilateral this time. We're actually crossing the pads. So right side of the oblique is now, going and talking to the pad of the left gastroc or Achilles tendon. And then we kind of go through that typical normal polarity, 4 sets, 5 to 10 reps, and then we reverse it doing the same thing. One of the movements that I have found successful, treating myself with this has been side lunges, but you could certainly do sit to stand or squat, and these have been pretty successful as well. The movement, it doesn't really matter for the most part. Just make sure it's something that the patient has pain or has trouble doing. That's what you want to try to push them through. and something that's pretty easy to do. Straight lines, right angles, keep it simple. And then, the final step here, and I know we're probably, I'm going through this quickly, so there's probably going to be some questions along with this. So if you can see that at the bottom at info@arpneuro.com. Any questions regarding what I've talked about today or anything that we talk about in general, feel free to reach out there. We do have a PRS library that's public on the website, and we are developing an RX library that'll be video-based specifically for all you doctors, where it'll be password protected. So just keep that in mind. On this final one, we keep the pad placements where we had them on the movement. So again, the black does stay where the gastroc and the Achilles tendon meet, and they're still crossed, still on the obliques. We just have the patient in a supine position, normal polarity. So in this case, now we're running the black upward, kind of getting that blood flow back to the hip, the heart, and things of that nature. And now we go from 500 back to 40. So as you can see, when we went through the movements, we were at 500 pulses per second. That's an ideal setting for movements. 40 is a little bit different. It's a little more isolated. It grabs a little heavier, and it tends to be, very successful in this particular protocol. And then we kind of run that one through comfort. So we're not pushing that one to the max tolerance. It's just where the patient can comfortably rest there for 10 minutes. So again, any questions on that? It's info@arpneuro.com. I know this is a new one. We will eventually have Jeff or Jen on here. They're going to go into much greater detail with this one and the success they've had with it in just using this. It's not specifically just for FAI. That's what I've personally used it for, and the results have been astounding. It's one of the reasons I wanted to share it. All right, so without further ado, we want to introduce our guest here. So before we actually bring him on, I want to give you a little background of him. His name is Dr. Jeremy Dinkin. And of course, after experiencing a neck injury during his college football days, Dr. Jeremy was introduced to the world of chiropractic care. This sparked a shift in his life and career trajectory, leading him to become a licensed chiropractor, as well as a certified strength and conditioning specialist. He runs his practice, RSM Sports Medicine and Rehab, out of Marlboro, New Jersey. Dr. Dinkin blends his expertise in strength and conditioning, nutrition, and bodybuilding with chiropractic care. His goal is to bridge the gap between the world of healthcare and the world of movement. And with a commitment to patient-centered and evidence-based practices, he strives to empower and educate patients with a holistic approach to treatments. Dr. Dinkin uses ARP Therapy in his practice and has seen results for accelerated recovery, pain relief, and improved physical performance for a variety of patients, including active adults, weekend warriors, and CrossFit athletes. Also worth noting, Dr. Jeremy has probably the biggest biceps in the New Jersey area and arguably in the nation. So everyone, please give a warm welcome to Dr. Jeremy Dinkin. Dr. Jeremy, let's bring him in. There we go.
What an intro.
I love the intro. I think we should change his name from Jeremy to Guns. I like the Guns as the name.
Oh, that's great.
Awesome. Welcome.
Thank you, guys.
Looking good, Jeremy. Good to see you. Thanks for being on.
Thank you guys for having me. I appreciate it.
Awesome. Yeah, I'd love to, if you could, just please give us, that was a great intro, by the way, Jake. Love to hear your story and please, tell us a little bit about yourself, your practice, some of your clientele, and how you came to find ARP technology.
Absolutely. So it's funny, you kind of said my story a little bit, but found chiropractic at like 19 years old, halfway through college football, classic sideline neck injury. And my neighbor happened to be a chiropractor. And so he cons me into going to his office. He saw me walk in with the neck brace on because I had to go home, and basically conned me into adjusting me as well. And so I had never gotten an adjustment, had no idea what was going on, but I was like, you know what, you can do everything, just don't do my neck. I can't even turn. And at that point, I thought I was going to be out for like a few months. So I'm like, please don't touch my neck, but I'll let you do the rest. And so adjust my whole spine, gets to the neck, and once again, he uses his manipulative ways to just get me to try it at least. And sure enough, I let him do it. And I was moving my neck completely fine after, had no pain, had no zingers. And so my world into chiropractic, my entry was a drastic one and a cool one. So immediately I was intrigued into that whole field. When I was done playing football and called it quits, I got a job with the same chiropractor, and he eventually forced me into going back to school. And I'd say about halfway through school, I had another, like midlife crisis type of thing where I knew I didn't want to do just chiropractic because I did have a strength background, strength training, football. I kind of wanted to go into that world. And so I did a ton of shadowing up and down the coast of California. And that's where I first saw ARP Neuro with Dr. Julia Moen, shout out to her in Manhattan Beach. And I remember being extremely intrigued into how she was, treating the whole body. Certain areas were correlated to other areas of the body. And it was, as a student, that was like super interesting. I had not been exposed to that yet. And then my first story with ARP was she had I believe it was an MS patient. And I witnessed this with my own eyes. He was coming in consistently, and I was doing my externship there. And they were always using the ARP Neuro with him. And it was an intense story. He was able to lift his legs after like 15 sessions out of his wheelchair. It was a wild, like, emotional moment for him. And so at that moment, I was like, this is an interesting piece of equipment. And I always knew in the back of my head, like, if I'm going to get anything, I'm going to do that. So that was my first experience with ARP Neuro. And then when I started my practice out here in New Jersey, Colin, one of the reps, came to me, I think before COVID, and he was like, you're a perfect fit for our brand, sports medicine chiro. We were heavy on the rehab side of things. And so you'd be like a perfect fit with our piece of equipment. And after a couple of years of him poking me, I finally decided it was time. And
wait, 2 years?
I think it's been 3 years. It was 3 years.
Wow.
That's pushback and tenacity.
Yeah, I loved it. I just, for me, I was very, I wanted to make things simple. My hands, manual therapy, gym. And I didn't know how I was able to fit a piece of equipment. I didn't, I had these, I was so anti-regular chiro that I didn't want anything remotely near what everybody else was doing. So like you addressed earlier in the presentation, it may seem like stim to most people. So I didn't want that coming off as like a stim unit in my office. And again, that's one of my self-limiting beliefs I used to have. But super glad I got over that and invested, and it's been a great time since.
Awesome. Yeah, I'd love to hear some of your success stories on your own. Tell us a little bit about some of the conditions that you utilize it for and some of the outcomes, because I think I'd love to hear some of that.
Definitely. So I'm definitely on the side of like progressing fast. I'm a little aggressive with progressing people through, just because traditional chiro and PT is you're getting very low level exercises for a very long period of time. And so I'm, again, anti all of that. I try to get people progressing as fast as possible. And so sometimes I am a little aggressive, but with the ARP Neuro, I can kind of hide that and trick the patient into thinking the exercise is pretty easy because they're focused on the stim. So a very cool story I have most recently is an Ehlers-Danlos patient, so a collagen disorder, very bendy. A lot of the stuff we just did was stability work, strength training, which she had never gotten before in any other office. Every other office had told her, you're going to have to live with this forever. She had worn an SI belt for 5 years straight. That was also a cool part of this story. Was afraid to not use it. Anytime she didn't use it, she would experience pain. She had pain regardless, but if she didn't use the belt, it was like a disaster. She went down the, classic chiro rabbit hole where they send you to pain management and then do the injections, and nothing was helping. And they just didn't give her any good answers. It was always like, yeah, you're just going to have to live with this. This is going to be, your life forever. And we're just going to do treatment forever and see if we can just like maintain your quality of life, word for word.
Can I interrupt you for a second? Just can you kind of break down what is that condition for those that may not have known what that actual condition is?
Ehlers-Danlos syndrome is, like I said, a collagen disorder. So they're very, very flexible.
Okay.
And this is another good point. It's people just think like if you could do a toe touch, like you're healthy, your spine's good. These people can bend almost upside down and backwards. You can twist them like a pretzel. They're just very, very flexible, like to the extreme, beyond textbook normal by miles. So people can be super flexible and still experience pain. Go figure. So everybody that told her, your range of motion is amazing, they were looking at the wrong things. So again, she was stuck for years in chronic pain with no answers. I am a cash-based practice, so she found me through one of her I think I want to say like a cousin's cousin, so a second cousin had been a patient prior and spoke very highly of the practice, and she was like, you know what, he's expensive, but I'm going to give him a shot. And so she committed. 3 sessions in, I started using the ARP. And in the beginning, it was mostly evaluation sessions, getting to know her, seeing where her level of exercise and fitness was at. So I always meet them where they're at. But after that, we start to push it. So I think after session 3, we started to use the ARP Neuro along with, I started her off with just regular box squat, body weight, simple for these people. It's just reintroducing movement very slowly. She had been, basically fear-mongered into thinking she'd never do this again. So it's a very slow, which I'm not used to. It's a very slow intro. But after about, I want to say session 6, so after 3 sessions of using the ARP, she reported back to me. She was extremely excited to say she hadn't used the SI belt that week. And so we continued to do it. By the end of her treatment plan, the first one, I think we started with a 12-pack. She's currently on her second 12-pack. She was able to go on vacation for the first time since 5+ years. Went on vacation, didn't have to bring a wheelchair, didn't have to bring her SI belt. All she brought was the medicine ball that I recommended. It's like a yoga ball just for her rehab exercises that I give her in here, and a foam roller. So that was, it was very cool. For me, that was one of the most eye-opening. Immediately texted you guys and was like, this is pretty sweet. So those stories really, it's take it for granted, but just to have an impact like that on someone's life is tremendous.
That's a great story. Thank you for sharing that with us. Impressive. I mean, one of the things that I am continually overwhelmed with is the outcomes, right? That's the kind of become our slogan, because it is really all about the outcomes. It's almost too, as you've experienced in your life, it's almost too good to be true. And so, it is kind of always about the outcomes. And we're getting more and more outcome discussions like this that are helping kind of lead the trials and or utilization of ARP Neuro for other clinics. We'll try to keep them away from the New Jersey area and away from you, so that you become the go-to. But in all seriousness, it's a tremendous, technology. Jake, can attest a little bit on the lack of the, not utilizing drugs and all the other typical pain medicines, and to be able to actually treat the body. It sounds like it's extremely important to you. Tell us a little bit more about some of the other clients and or patients that you typically treat in your clinic.
So typically it's active adults. I do have one level 10 gymnast who's in high school. He is obsessed with the machine. He refuses to not let me use it. It's been great for him because gymnasts, especially at that age, they're practicing literally 5 hours a day. It's a crazy sport. So he came in with like 6 different things, right? And what's cool about the ARP is I can, first of all, pinpoint exactly where we need to put it, the pads. And secondly, we can do 2 areas of the body without like me not doing my regular process. So I can put him in the rehab exercises that I want to do, but we just add that secondary part with the ARP Neuro, and it's like, it's a game changer. And they feel it, obviously, because it's something like they've never felt before. The second I always put the pads on, I ask people, does this feel like anything you've ever felt before? And on purpose, 99.9 of the time, everyone's like, no. And you'll get one like smart ass that says like, oh yeah, it feels like the stim. So it is great to, get feedback. And when I had Jake and Colin come in and do the trials, by design, I brought in my most loyal and trustworthy patients that would tell me straight up, like, how'd you like it? And every single one of them was like, you need to invest in this ASAP. So that was cool. And those are the type of people I work with. People that, like I said in the beginning, I am a cash-based practice. I like to think of our practice as the best in New Jersey. So we have elite level care. Our prices are high where they should be. And it's one-on-one the whole time. People that are invested in their health, people that care, they want to get better. They've gone around the block. They know that the traditional route doesn't help them. A more integrated and customized approach is better for them. So typically that niche is anywhere from your weekend warrior to elite level 10 gymnast.
Yeah. And Dr. Jeremy, I saw that firsthand in your office. There is a lot of like one-on-one interaction and hands-on work. It was impressive to see. So clearly your doctors love you so that they're going to be honest with you. So yeah, it's nice to hear. Have you done anything else with it on a performance side, or has it been all for like recovery?
Well, technically the gymnast that I talk about, he's out of pain at this point, and it's more so like now it's more so on the performance side. I've done performance side things like for myself and a couple of my colleagues, other chiropractors, that we just kind of mess around in the gym and like see what we can like manipulate in terms of like biasing specific muscle groups in training and bodybuilding and stuff like that. But more so, I like it for the pain, especially in here. I like to be known locally as like the guy that gets people out of pain instead of confusing that. I don't want to like, what's that called? Impede on like a personal trainer. So I still, market myself and talk about the pain stuff more so. But for my own curiosity and for the people that I've worked with for quite some time, I'll do the performance side of things.
Nice.
Well, I got to say, if you've used it on those guns, I mean,
yeah, I was going to actually ask that.
That's a game changer. Come on,
I have not yet. I will try. I haven't yet.
Out of curiosity, where did you play college football and what position?
Locally down the street. So I originally went to Iona, full scholarship. They dropped the program after my freshman year. Heartbreaker. Okay. Yeah. So at that point, I was kind of frustrated and I just want to play. So I came back local, literally 20 minutes away from my high school, Monmouth University, Division I AA, and then finished out there.
Nice. Very cool. And what position?
Corner and receiver, both for both schools.
Very good. Nice. Awesome. So go ahead, Jake. It looked like you were going to say something.
Well, I was just gonna kind of add, because with your background and the movement, is that what you predominantly have? Is just a lot of active patients? Can you give it sort of a brushstroke of like where you kind of fall in between on that?
Yeah. So where I market myself, and like, if you see the social media, it's clearly geared towards like barbell athletes, people who are trying to get strong, people who are tired of the traditional route and want to get back to training. It's mostly that crew. However, word of mouth and referrals, you can get basically anybody. I haven't done any digital ads yet or nothing like that, so I haven't got like totally random. But like the Elor Damos patient, like she's not active. She's not my perfect client. But it was cool because at that point it showed me that like I don't have to market to those people all the time. I can market to other people as well, because she probably would have never found me if she wasn't referred. Like she wouldn't have looked up sports medicine chiro near me, So
good point.
It's a wide group. My target though, like where I post and market towards, is more so like people that love barbells, people that love CrossFit, people that love training hard and can't figure out their musculoskeletal injuries. That's kind of my crew.
Yeah, you have some really creative videos, movement based and just in general as far as your advice on Instagram. Would you mind kind of talking about that a little bit?
Yeah. So like I was telling you guys before, I was a little shy in the beginning, and I realized in the first probably 2 years, honestly, first 2 years of practice, it was very like self-consciousness, like eating me alive. Like I had to sound smart. I had to sound perfect. It had to be detailed. And I realized that I was just marketing myself with those posts to other colleagues. Right. And I was like, well, they're not going to be my patients. They just want to learn from the post. So I started to realize that, and I made a complete 180. Started to make my posts very simple, a lot more entertaining. If you've seen the posts, hopefully they're a little funny, and also educational. So a combo of all that, more so for the layperson, more so for the people that are frustrated with their healthcare system and what they've already experienced. I've kind of tailored my way into like messaging for them, not so much trying to sound the smartest, trying to be a biomechanics teacher. Like most people don't care. They just want to know if you can help them. And so making that more of my message now and like making it a little entertaining and a little funny, but also educational. I think people really gravitate towards that. And now I can see, now my followers list is more so, regular people, not just clinicians.
Well, and it's funny, it's educational, but it's also entertaining. And that's hard to pull off that trifecta on something like Instagram. When you're trying to reach a certain audience, on that platform. So
it took me a while, and it took a lot of caffeine.
I love it. Yeah, I enjoyed them, and it's been great. I think we're trying to do the same as we're trying to educate. Education is the key, right? And that's why we're so adamant about having our patients to, do a very quick little 5-minute testimonial that we can continue to add to our library on our website, just because weekend warriors, if they have an issue, it's great that it's helping all these professional athletes, but, not everybody's a professional athlete, very small percentage. I'm a pickle athlete, or I play golf, or I've got a tennis elbow. Those are the people that I think this technology can benefit the most. So, it's all about the outcomes. And I think as you've kind of shared, it's, you get somebody out of pain, they're telling 10 people, and now you've got 10 new clients. And then they're going to tell 10 people. And, so I doubt you'll ever have to really do any kind of advertising. At least that's kind of what we're finding with a lot of our clinics. So really love it. I do want to add, if there's any questions, I'd love to open this up for some Q&A. If there's any questions, I want to try to be cognizant of the time. And so if there's any questions, please share that so we can ask. But yeah.
And I want to say, Matt, I'm very bummed out. I got to be honest.
What's that?
We have a new gentleman here. He wants to work. I was hoping to show pad placements. So at the end, if I don't get a question, I'm going to show a specific pad placement that's really good for low back, because, we can't pay him and then not have him work and just stand here looking pretty.
Good point. Good point. So, so I guess, if there's no questions, really, I want to, first of all, thank you so much, Dr. Jeremy, for your time.
Of course. Thanks for having me.
We'd love to have you on again. I mean, this is all informative. What we're trying to do is to just really treat these as an opportunity, as a training, but also to learn from folks like yourselves, because there's so many other clinics that are now starting to take on this technology. We've got a lot of people now utilizing the PRS, which is very similar, very easy to use, same technology. And, the more they hear of how they've utilized the technology to treat patients, at the end of the day, the outcomes are going to benefit these patients. And that's kind of really the whole intent of what we're trying to do. So I can't thank you enough.
One second, Matt. Sorry to cut you off. We do have a few that just kind of came in. First one I want to share from Dr. Camacho. Dr. Camacho, thanks for joining in. Thanks for being here. And Jeremy, do you have any advice to any new users with the ARP device? That's a great question.
That is a great question. So for me, I was overwhelmed at first with like the endless possibilities that you can be creative and stuff like that. So don't overwhelm yourself. Make it simple. Keep it simple. Like do the classic protocol that you like, that you're comfortable with, just in the beginning, so you're comfortable with using the machine. And now, what Jake taught me, I probably don't use any of the day one stuff that he taught me. I do my own thing. I found a way that works for me, that works for the clients. And then like I said in the beginning, I incorporate that with my own rehab, my own creativity in terms of strength training and exercise selection. And then I just do my own thing, essentially. So I would say don't get overwhelmed. Learn the machine slowly and surely, and then start to get creative as you get more comfortable.
Fantastic.
Great answer. I think, Jake, I'll take it second. I think that's exactly the protocol that Jake talked about earlier on today's Q&A is exactly what, that was, somebody else's, one of the other clinics, kind of diving in. So we love, hearing from everybody, all these clinics, so that we can kind of continually grow the protocols, to make it even that it is such a powerful tool that, it is trying to simplify it so it makes it not overwhelming for those new offices. So great insight.
And what is your Bicep program? Just curiosity. Dimitri, thanks for that question. I know everyone's asking.
Just switched out of powerlifting officially, so I'm just adding in an extra day of biceps.
Nice.
Go figure.
Very nice.
Yeah. So just an extra arm day. 2 days a week. And
so for guys like me, just please tell me it's like 5 minutes on a session. Is that about it? Is that all you need?
Yeah, that's it.
5 minutes.
That's 2 good sets. So yes, that's all you need.
All right, good.
Perfect.
Awesome. Well, any other questions, Jake?
Let me see. Here's one for within your office, Dr. Jeremy, any specific pathologies that you have seen that did not improve with the ARP device so far since you've been using it?
I'm trying to think. Not that I'm aware of.
That's a good sign that you have to think that long.
I know. I really, because I'm trying to think of like even people that I've failed myself. I really can't. I wouldn't blame ARP. That's for sure. I don't think, there's people are going to feel it. And for 99% of the people out there, like just feeling something different is going to be like, oh, like, is it going to stick forever at that one session? No, obviously. But like in terms of like not working or making it worse, I don't think so.
Cool. Tyler, thanks for your question. That basically answers it, based on your experience. Some are more difficult than others. I know sciatica is a rough one. It can be tricky.
Right. Exactly. There's complicated cases and stuff like that, and that's exactly why I do my business model now. There's nothing less than a 15-pack now. It's unfair to both parties if you promise something any less than that. And it's the injuries that I see, especially I'm like a last resort type of clinic. They've been with chronic pain for years. 5 sessions is not going to do it.
Love it.
So being clear on that and communicating that is big.
Fantastic. Thank you.
Yeah. And if anybody that's watching this, if they want to find you, they can go to the ARP Neuro website, find a clinic in New Jersey. You'll be able to write directly to his website and contact information. And so,
and his website is rsmsportsmed.com. Is that correct?
Yep, that is correct.
Awesome.
Cool.
Well, good stuff. Appreciate your time.
Thank you guys. Yeah.
Very nice to meet you virtually. So wish you all the best. And we would love to have you back on for a future session if you'll have us.
Absolutely. I'll come through Chicago soon.
Very good. I like it.
Sounds good. Dr. Jeremy, thank you so much. It's been a pleasure.
Thank you, guys. Have a good one.
Have a good afternoon.
Thank you, everybody, for joining in. ARPNeuro.com.
Bye-bye.